Yeah, thank you, sir. Thank you invite me for this kind of meeting. The master, but I consider myself as still a student. So this is a great honor to present my journey from the open surgery to the endoscopic surgery. So and the other thing is that I live in different setting and different island from Dr. Luffy and Tim. I live in Sumatra, and that's why I learn and I teach myself directly. And this is my early experience in endoscopic surgery for 2 years. And as we know that I learned and I was trained as an open surgeon. So I just like an ordinary spine surgeon, you need to open all the thing to see such a small pathology just to take it off the patient. And you can see how big the wound of that. A lot of complication. As we know, laparotomy so big is 15 years ago, 10 years ago, we're still doing it. And then after that, as you know that open surgery, you have to do the muscle resection, the bone resection, and end up at about 10% of the stability and the failed back surgery symptom. And then after that, I still do the microdisectomy. Still, I have some difficulties and complication. I'm using the microscope, but I found that my patient was not so happy. So I learned about endoscopic. So I trained myself, went to some several workshop. I went to India. I went to see the great name in endoscopic, and I went to see some master in endoscopic. I hope I changed my paradigm and my the way of doing the thing. And I at the end I tried to do my endoscopic for the spine pathology. And then I'm doing for, firstly I learn about transforaminal, and then after that I move interlaminar, and the end I do the stethoscopic PSLD as well. And I try to present my 2 years experience. I did 128 patients underwent a endoscopic. I did inside out mostly, and interlaminar and PSLD. And I still did some microscopic surgery. The average hospital stay for the endoscopy is 1.5 days. And then I evaluation about the visual analog scale, the post-op, 6-month post-op, and alteration of the fast and operating time, failure rate, blood loss, and complication and reherniation rate. And this is my record that I found that the PSLD is the most difficult, and for the transforaminal, for me is almost 1.5 hours and about 2 hours generally. And then this is my operating time, and I found that I'm getting better after the 20, 30 cases. And this is a visual analog of all the cases that I did. It's significant change of the visual analog score, and as well as the ODI from the almost 40 to less than 10. And then as well as my post-op, the NABB criterion, most of the patients, if I ask them whether they want to do it another, if they have such a problem, they will do, and they choose endoscopic their surgery. And then for the complication, I found that the 10 cases, I have dysaesthesia and I have to change with the disc residue. I have to open surgery for the 5 cases. And then I found that the PLD is easier, interlaminar and friendly because its anatomy is same as the microscopic. But I found that PSLD, because of bony work, I'm still struggling to doing it. It's harder to learn, I think. And then I found that this is my conclusion, that learning curve is steeper than the traditional surgery, and I needed to recognize the anatomy and practice. And the paradigm of the see one, do one, teach one does not apply in this kind of surgery. I think, thank you, Mr. and Professor Malcolm, for your time and opportunity. Thank you.